You're welcome again. We want to talk about the causes of sore penis after sex. And when we're talking about a sore penis after sexual activities or intercourse, it is not always a cause for concern. But if you are experiencing other unusual symptoms, it may be the time to make a short visit or an appointment with your healthcare provider so that to prevent further complications. You understand? And when we're talking about this, although mindfulness can often be treated at home by yourself, infection and underlying health conditions requires medical attention most of the time, urgent medical attention. So what are we talking about? We have various symptoms to watch out for. And the ways we can find relief, maybe when to see doctor and all that. So that is what we're going to be talking about. So dive in with me as we talk about various causes. Number one cause is lack of lubrication during sex. When you don't have enough lubrication, you are using the wrong type of lubrication, there can be friction which can irritate your skin, especially if your partner is not sufficiently lubricated and you come down with various type of sore. Then if you're rubbing your penis against another person's body, it can wear away the upper layer of the skin. The vagina area is so, if your partner is wet, is so soft that if you have penetrative sex, you might not feel pain. But if you are rubbing it against somebody else's body, it might be an issue. And this can also expose the sensitive layer underneath that contains nerves and connective tissues. And of course, what happens? You start having sore after sex. Another thing that can cause it is prolonged or vigorous sex. And when you have vigorous and you continue like 30 minutes, 45 minutes, or you have not a prolonged one, but it's vigorous, or you are having any type of sex, or you have not had sex for a while, and now you want to do it, and you are making it rigorous, or you want to stay longer, it can make your penis to be sore. And of course, soreness may result from being erect for a long time. If your penis is as an erect for a very long time, it can strain and sometimes just the muscle and the tissues surrounding your penis. And of course, it can delay ejaculation, DE occurs more, especially if you have sex and you're having sex more than 30 minutes, you are taking more than 30 minutes from sex or masturbation before you ejaculate. It's probably you're having delayed ejaculation. Some people are born with delayed ejaculation. It can also result from anxiety, stress. Anxiety, maybe you are meeting this person for the first time and you want to show them that no, you are capable of what you know, your stuff. Or stress or certain medication like some antidepressant, the guy on hair loss treatment, prostate treatment, or urinary infection can cause it. Hormone imbalances can cause it. Pelvic or spinal nerve damage can, of course, result in the not being able to ejaculate, can also cause swelling and soreness and tenderness in the penis area. You understand? So, when you begin the penis, and of course, even the scrotum can get swollen and there might be issues. Then these symptoms may last a few hours after sex or until the blood fully drains from the penis. When the penis goes back into its original state, the pain and the soreness might subside. Then, of course, we have allergic reaction. It might be to condom, like myself, I don't use condom. If I use condom, I have irritation, I have allergic reaction, so I don't use it. Or lubricants or other product, it is possible to have allergic reaction to some materials or chemicals inside condom. You understand? Then lubricant can cause it, especially the oily lubricant. Some sex toys and other sex product can of course cause sore in your penis. And we call this one irritant contact dermatitis. It's a type of allergic eczema. And of course, if you have sexually transmitted infection, STIs, In some cases, the soreness may be the result of an STI. So although many STI are asymptomatic most of the time, you might not feel them. Soreness may occur with most of them. Soreness may not occur with most of them. But soreness may occur with the following condition: when you have chlamydia, is a form of sexually transmitted infection. When you have gonorrhea, it's a form of sexually transmitted infection. You have trichomoniasis or something, it is one of them. Genital herpes is one of them. And of course, this soreness will only fade away with treatment. You need to see your doctor or healthcare provider if you suspect that you are having any STI, whatever form it takes. Then, of course, one of the things that can cause soreness is prostatitis. That's when your prostate gland gets inflamed. You understand? Or maybe as a result of or infected. The prostate is just a small gland under your bladder. You understand? That helps. Is one of the process is one of the it's just below the bladder, one of the organ that produces one of the component of semen. Then maybe you have phimosis. And when we're talking about phimosis occurs when you cannot, phimosis occurs when you cannot, excuse me, phimosis occurs when you cannot pull the foreskin back from the tip of your penis. And this results often from an infection of the head of your penis. And when it happens, infection can cause this area to be swollen. And of course, make it difficult for you to pee. So, make it difficult for you to pee. Make it difficult for you to get an erection or ejaculate without discomfort. So yeast infection also is one of the causes of soreness of the penis. Yeast infection results from an overgrowth of Candida. Candida is a fungal infection, Candida fungus. This may be caused by several factors, including having a weak immune system. Your immunity is low. Maybe you are on a particular medication, or you have poor hygiene. Then another thing that can cause it is urinary tract infection. And urinary tract infection are also caused by bacteria, viruses, fungi, but depending on the severity, the pain and other symptoms can also show up in your kidney, ureters, bladder, urethra, and all that. So it is better to see your doctor. Then, of course, we have Peyronie's disease. And when we're talking about Peyronie's disease, it's usually when there is a scar tissue that builds up in the penis over time. You understand? Maybe the result of trauma or previous surgery or something. Then you now cause it to sharply bend to the side or upward when you are erect. You understand? And of course, when this happens, it can make your penis sore during or after sex. So those are some of the things. And of course, another point is post-orgasmic illness syndrome. POIS, post-orgasmic illness syndrome. And when we're talking about this, it's a rare condition thought to be caused by an allergic reaction to your own semen. It's just like when we're talking about autoimmune diseases. Semen, or to the chemical and hormone released after you reach orgasm. So it is a syndrome, and its exact causes are not entirely clear. You understand? So if you are seeing all these things, it is better for you to see your doctor. See you in the next video.